baby has with a closed with a closed palate, or a baby who was not born with a cleft palate. So that's a very important part of the speech mechanism. Now, other issues are because the baby can't make the vacuum, when the baby swallows, it has a hard time opening up the eustachian tube. And you may know the eustachian tube is what we open up when we go up in an airplane rapidly or we take a fast elevator in a skyscraper. You may notice that you want to swallow hard or push out, because what we're trying to do is equilibrate the inner ear with the tympanic membrane connected to the external ear with the outside air, the ambient pressure. So if a baby can't make that vacuum because of the cleft palate, then a baby can't clear the inner ear or the middle ear. It won't drain, and so a baby gets chronic ear infections, and that can lead to otitis media, of course, and that can actually, if untreated, really interfere with the baby's hearing, and can go on to very dangerous conditions such as mastoiditis, which is an infected mastoid bone, that bone you can feel behind your ear. Also, the oral pharyngeal hygiene is interrupted with a cleft palate. I mentioned possibly poor hearing. The speech is just really difficult for a baby with an unrepaired cleft palate. So, a baby will likely get a cleft lip repair in this country at about age 3 months, a cleft palate repair at about 9 months, 10 months, 11 months. It's important that we try to close that before the baby learns to speak. And then at about, before the adult teeth erupt, a baby will probably get a bone graft to the alveolus and maybe an alveolarplasty. Later on, a baby may get a nose revision or a rhinoplasty. Sometimes, if a baby is not speaking clearly or a child is not speaking clearly, there's an opportunity to do a speech operation. Typically, I like to do a pharyngoplasty. That's when we tighten or rearrange the muscles in the back of the throat so that sphincter works better. And when the soft palate comes up acting as a flutter valve, it's able to touch the back of the pharynx, and that's called velopharyngeal competence. And so a baby may be eligible for speech surgery, but certainly what we try to do is get the palate repaired, get the baby and child into speech therapy and practice and learn to speak those words like cookie and Coca-Cola, etc. Now, there's one more operation sometimes that we do, usually at an adolescent age. We do a Lefort osteotomy. We can actually bring the midface, the bone that holds the teeth forward. That's called a Lefort osteotomy. Sometimes a baby, because of the cleft lip, because of the cleft palate, their scar and the anterior growth of that midface is diminished. And so to have a more functional occlusion, to have a better looking child, to have the teeth lined up in a more physiologic position, we'll do a Lefort to bring that bone forward. So as I said, in this country, if a baby is born with a complete cleft of the lip and palate between the age of 3 months and probably 15 or 16 years, the baby will likely get 5 operations and can grow up to speak well and look good and be beautiful and handsome and go on with their life. In these countries where we go and travel to, these developing countries, they may be short on plastic surgeons who are trained to do these operations. They're short on supplies. They're short on operating room time. They may be short on things like suture and anesthetic gases. So we go to these developing countries. We like to teach. We like to work with the doctors and the nurses. It's not like we're going in there and we say, gangway, the Americans are here, the Europeans are here. We're going to operate on your kids for you. No, we like to teach and we like to work with them. Oftentimes we do information exchange and we can show each other techniques. For example, in the country of Chile, that was the first Rhodoplast trip. I took a small team to Antofagasta, and the co-originator, along with Peter Lagarius, Dr. Angelo Capozzi, took a team to La Serena, Chile. We operated separately for about a week, and then we combined forces and worked together for another week, and Rhodoplast was born. So for example, that was over 20 years ago. The country of Chile has taken over their own Rhodoplast program, and so they operate on their own children. They're well trained, and we're just delighted to sort of work ourselves out of a job. I think for now that's a good introduction. I think what we'll do now is take a very brief pause for a very good cause. We're going to come back and I'm going to talk more about Guatemala, operating in Myanmar, how these programs work, the support by the Rotary Club or Alliance for Smiles or Plasticos. And I'm so delighted to have your attention and so delighted you can view these segments, because it is one of my favorite parts of my year is going overseas to operate on children. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California, and this is the Doctor Is In television program. We're coming right back after a very brief pause for a very good cause.
It's scary making the decision to have reconstructive surgery, but it's so worth what you get out of it.
I'm stress-free. I know I'm not going to get breast cancer.
Everything is back to normal, and it really did not take long to bounce back.
I have a sense of hope for other women that this surgery can help them to live normal lives.
This year, more than 200,000 women in this country will be diagnosed with breast cancer. For many of them, a mastectomy or removal of the affected breast will be recommended as part of the cancer treatment.
The idea of losing a breast for some women can be almost as difficult as being diagnosed with breast cancer. Modern breast reconstruction can help. The purpose of this presentation is to provide women with valuable information about the major issues in breast reconstruction.
We'll have an opportunity to speak with women who chose different methods of reconstruction. We'll talk to experts in the field of breast cancer, and we'll let you know your options for breast reconstruction.
I embraced the mastectomy and reconstruction procedure, and because of that, I had a terrific outcome, and it's changed my life in a positive way.
For the thousands of women who will be diagnosed with breast cancer this year, we understand this is most likely a troubling and frustrating time. We hope this presentation's been valuable to you and will help you make some very difficult decisions that you're facing.
Welcome back to the Doctor Is In television program. I'm Dr. David Morwood. I'm a board-certified plastic surgeon here in beautiful Monterey, California. Thank you very much for being with us. What I'd like to talk about in this next segment is more about operating in Guatemala. I was there about a month ago. This is one of the 3 missions, humanitarian missions I went on this past year. First, I went to Cuba with Plasticos, a great humanitarian organization based down in Southern California around Newport. And the other 2 organizations I go with are Rotoplast, it's Rotary Plastic Surgery, sponsored by Rotary International and the Rotary Club. And then I came home after Myanmar in Southeast Asia, and then I went to Guatemala. Guatemala experienced a severe volcanic eruption earlier this year, and what we see oftentimes in these developing countries, when there's a natural disaster or a humanitarian disaster, what happens is the social services, their energy and resources are turned away from the children, of course, with problems such as cleft lip and cleft palate, and it goes towards helping with the natural disaster or the problems with the hurricane or the volcanic eruption or the emigration out of the country of the Rohingya. So, as I said, we went to Guatemala with Rotoplast. We flew from Houston to Guatemala City, and the local people put us up in a very comfortable hotel. We went to the hospital there, the public hospital of St. Lazarus, where we operated. And the way it works is the Rotary Club and these humanitarian programs there in a host country will spread the word, and they'll let families know that the Rotary program clinic will be open on a certain day in a certain town at a certain time. And so if you have a baby or child with unrepaired cleft lip or palate, or they need a revision, report to this clinic on a certain day at a certain time to be evaluated by the Rotary International team. It's a pleasure that we got to operate with Dr. Milton Solis down in Guatemala City. He's one of our host surgeons. He's a terrific plastic surgeon, very good at cleft work. And we arrived there and got to work. We go to triage, and what triage is, in the clinic, we sort the babies and check up on them, and Dr. David Lowe and I got to work with Dr. Solis. Dr. Lowe is from Philadelphia Children's Hospital, and so what we do is evaluate the children for appropriateness for surgery. There are always some babies and children we meet that are probably too sick to have an operation right then because maybe they're having an illness or an exacerbation of a problem they have. Sometimes we feel they'll need an intensive care unit, and we feel it's not safe enough. And again, there's some babies or children with problems that we feel could be appropriately addressed by the local surgeons there. So on these trips, we try to do at least 100 babies and children, at least 100 operations, because the cost to Rotary International or the Rotary Club is between $80,000 and $120,000 each trip. So if we can do at least 100 children, we feel it's very well worth it. In Guatemala, we did about 132 operations. In Myanmar, we did, I think, about 126 operations. So it's very well worth it. We feel that they're very hard-working trips. We get a lot of work done. We build goodwill. We like to work with the doctors and nurses in the host country. We do information exchange. And of course, it's really hundreds of thousands of dollars worth of surgery performed if those operations and surgeries were done in this country. Of course, if we can do 130 operations in Guatemala or Myanmar, and it only costs about $80,000 to $120,000, well, we feel it's very well worth it. None of the medical people get paid. It's all volunteer work. In fact, it costs us some money, of course. So what are the type of cases that we do? Well, primarily we do cleft lips and we do cleft palates. As most of you know, a cleft lip is a split in the lip that you can see. That's on the outside. A cleft palate is a split in the roof of the mouth. The roof of the mouth has two parts, the hard palate, that's bony, and the soft palate, that's more towards the back, towards the throat. The cleft can be in the soft palate alone, or it can be in the hard palate and the soft palate. It can dramatically affect a child's speech. They get more ear infections because they can't drain their eustachian tube. The oral pharyngeal hygiene is interrupted. They get ear infections, as I said. Their hearing can be infected. And of course, the big problem is that their speech is very poor. Also, when they're babies, they have a hard time suckling because if there's a cleft in the roof of the mouth, they can't make that vacuum and they can't suckle well. And in certain words like cookie and Coca-Cola, where our soft palate is designed to touch the pharynx and very carefully distribute the flow of air between the nose and the mouth, that flow of air is dramatically interrupted and the babies get what's called a nasal escape. And so their speech is really poor and they have a lot of difficulty saying certain sounds, certain plosives and fricatives, and they need speech therapy, etc. So it's more than just a cosmetic surgery operation. We do the cleft lip repairs at about age 3 months in this country. We like to do the cleft palate repairs at about age 9, 10, or 11 months in this country. We don't always get that type of ideal timing when we go to developing countries on these humanitarian missions. So we do as much as we can with the resources that we have, being safe. So as I said, we met a local plastic surgeon there, Dr. Milton Solis, and we, the chairman, as I said, from Philadelphia, and myself, we traveled with this team of about 20 people, and we go to the triage clinic. So we triage these babies and children. We have the opening clinic. We sort them. We rank them according to priority, and we get to work. We set up operating rooms. We bring anesthesiologists. We bring OR nurses. We bring a couple of pediatricians. We bring some volunteers. Now that's an important point I can take a minute to talk about. Sometimes people say to me they would love to help, but they don't know how to do a cleft lip repair. They don't know how to